All right, time for Family Health. Beatrice is here, of course, and tonight we're talking about HPV infections.
Ontario has been vaccinating school girls in recent years, but now officials are saying better late than never, and they're encouraging men and women well into their 40s to get the shot as well.
Indeed. Now, most young adults will be infected with the human papillomavirus, or HPV, within the first 5 to 10 years of being sexually active. But infection can happen at any time in life.
Most of the people here are playing catch-up. Toronto Public Health is holding an HPV vaccine clinic for girls aged 14 to 19 who may have missed the HPV shot when they were in grade 8.
Both my wife and I wanted to make sure that she did get the shot. There's a history of cancer in the family, and we want to do everything we can to protect Jillian, protect our children from any risk.
The HPV vaccine, called Gardasil, protects against 4 strains of the human papillomavirus. It's been shown to be anywhere from 90 to close to 100% effective. The vaccination as children before becoming sexually active is the ideal. The vaccine is also effective for adults.
Young women and men tend to get it in their early 20s, and then we see a second peak occurring around the 40s.
Many of Jane Greer's patients have new sexually transmitted infections later in life.
So if people have been in a relationship for a long time and now they're no longer in that relationship, so if they don't have a history of HPV, they're the perfect candidate for this.
Studies have shown getting the vaccination in your 40s or 50s can provide protection, and the vaccine can still benefit you even if you've already had an HPV infection.
The second best time is when there's an abnormality, because now you know that you're someone who has reacted to the virus, and this will reduce your risk of having trouble.
HPV can lead to various cancers, including penile, anal, and throat cancers, as well as genital warts in both women and men. Australia has been vaccinating most girls between 9 and 26 since 2007, and it's paying off.
They are now speculating that genital warts may disappear entirely because they've seen such dramatic reductions. And the other good thing is they're beginning to see a reduction in the abnormal pap smears coming through in young women who've been vaccinated.
The vaccine is only free of charge for girls in Ontario in grade 8. Otherwise, it costs about $450. It may also be covered through some private health plans. The vaccine is also approved for boys aged 9 to 26, but again, that's something you'd have to pay for. Absolutely.
Now, let's talk about the older adult, because we keep focusing on women in the mid-40s, but we should be talking about men as well.
Absolutely.
If you're sexually active, this is the way to go.
Absolutely. And it's not necessarily just for males aged 9 to 26. You can speak to your doctor about it, but it would be an off-label use of the vaccine. And so far, the safety and efficacy studies have shown that the vaccine is quite safe.
So for men, it's about preventing the spread of cervical cancer in women from human.
It is, but it's also about preventing penile cancer, anal cancer, throat cancer in men as well as the spread of genital warts.
Right. All right, B. Thank you.
You're welcome.